Hi everyone, this is Renee again, and in this voiceover we're going to cover cerebral palsy. This is a name given to a group of conditions that affect motor development in children. It can be mild with abnormal tone and weakness in one extremity, or it can be severe and it can affect all extremities. It can affect growth and development and the intellectual capabilities of the child. So cerebral palsy is a result of damage to the brain. It's either during or after the child is born. If the damage occurs before or during birth, it's called congenital cerebral palsy. And if it occurs afterwards, it's called acquired cerebral palsy. So a quick overview of it, again, it is a chronic disorder of posture and movement that is non-progressive. There are a lot of different comorbidities that can happen with cerebral palsy, including cognitive problems, hearing and speech issues, visual impairments, and seizures. But with the children, you will see their disabilities are going to range greatly. There are 3 different spots that this lack of oxygen can cause cerebral palsy, and that is before, during, and after birth. So there's different times when this can happen. So this slide just shows you the different types of cerebral palsy that you could see in a client. We're going to focus on the overall care for all of the types. Okay, so how does cerebral palsy present? Like I mentioned before, and I really can't stress this enough, cerebral palsy can present differently in almost every child. But some of the common clinical manifestations include delayed gross motor development and abnormal motor performance. So you guys learned about developmental milestones in previous lectures and probably with Molly. What's important with these children is to remember that this is commonly how they're going to be diagnosed, because these children are not meeting these developmental milestones. So we can see alterations in muscle tone, abnormal posture, and disabilities that can include sensory, communication, and intellectual problems. Moving on to diagnostic evaluation of cerebral palsy. So definitive diagnosis of cerebral palsy really cannot be made until the second half of the first year of life. That's because when they're aged 6 to 12 months, this is when we start to see the delayed motor development, like not being able to crawl or turn over. You'll see a persistence of primitive reflexes. Once we see that these primitive reflexes aren't going away at this age, it is often concluded that something is wrong, and that is when we start to do neurological exams and other diagnostic studies. We want to do a thorough history on these children. We can also do EEGs, CT scans, MRIs, check electrolytes, and often a metabolic workup. So even though cerebral palsy isn't definitively diagnosed until 1 to 2 years, the brain damage can actually be seen on brain scans in the form of characteristical cysts that are a result of the brain damage. In time, these cysts are reabsorbed, and what that does is leave behind abnormally large ventricles. Large ventricles will lead to an enlarged head. So as nurses, when we're assessing these clients, we're often going to see that they have abnormally large heads. Therapeutic management of cerebral palsy. So early recognition is definitely key to success. You want to be able to maximize the child's abilities, and that can be done by recognizing it early and intervening early. Our goal of treatment is to promote optimal developmental course, maintain highest functional level through locomotion, communication, and integration of motor function. The parents of these children are definitely essential to the treatment program. They're going to need support and guidance, and there's a lot of things that the parents are going to have to do at home to help their children as well. There's also medications that are used as part of therapeutic management of cerebral palsy. Baclofen, which is a skeletal muscle relaxant, is used to help with spasticity in these clients. You'll see more about this in the medication PowerPoint, and if you've been to St. Margaret's, some of you have, some of you have not, you'll notice that a lot of the children there are on baclofen. There are many supportive therapies for cerebral palsy, but the 3 you should really know are the physical therapy, occupational therapy, and speech therapy. Physical therapy is most commonly used as a conservative treatment for these children. It can help achieve functional goals while focusing on preventing contractures of the joints. Occupational therapy will provide training in manual skills and ADLs such as feeding techniques. This can help promote the child's independence and makes them less dependent on others. With speech therapy, we really try to begin this at an early age, before the child starts to develop bad habits of communication. Schooling and formal education. So schooling and formal education for these children are really going to be determined by the individual child's needs and potential. There are individualized education plans, also known as IEPs, to help provide goals and structures for meeting these requirements. The education needs to be geared towards the child's assets at any phase or in any setting of their education. As I said already, every child is going to have a different level of functioning. They will have different needs and will have different goals. So it's really important that their education is individualized for them so that they can really reach their full potential. Recreational activities are a necessary part of growing up for any child or adult. So we really need to make sure that any child or adult with cerebral palsy is encouraged to take part in any recreational activity that they can. It can really stimulate their interest and curiosity, and it can help build their social skills and self-esteem. So this slide really gives you an idea of the family support and education that goes along with cerebral palsy. As a nurse, we need to make sure that we're providing information and emotional support to these families and these patients. We also want to provide clarification regarding what to expect. So while it isn't a progressive disease, we do want to provide information on what to expect through the years as this child develops. You want to provide support and understanding from those with shared experiences, and to do that, we can provide families with resources. This concludes our voiceover on cerebral palsy. As usual, if you have any questions, please feel free to reach out to me.